cortisone shot, we put it into the subacromial space above the rotator cuff tendons, and what it does, it obviously doesn't make a tear go away, but it can decrease the inflammation associated with a shoulder injury, which decreases the pain, which can increase your function. So many people get cortisone injections and then they say, why is my shoulder still hurting? Obviously, cortisone injections don't work all the time. They usually work extremely well to kind of decrease the amount of your pain and kind of localize where the pain is coming from, but obviously they don't work all the time. You can get a cortisone injection roughly about every 3 months as needed, as long as that decreases your pain and allows you to do all the activities you desire. But when do you move past a cortisone injection and talk about something such as a surgery to fix the problem is usually when the injection is no longer working or it's not working long enough. So many people get an injection and they feel great, but it only feels great for a week, 2 weeks. Obviously that's not going to work because you can only get one of those injections every 3 months. So if it's not giving you enough pain relief or it's not giving you a long enough pain relief, that's when we recommend that people come in and talk about kind of the next step, which potentially could be surgery. So if cortisone injection is not working, it's extremely important to get an MRI of your shoulder. And the reason you want to get an MRI, we want to make sure if we're going to treat something conservative, that we're treating the correct thing conservatively, and we're not missing something that should be treated a little less conservatively with surgery. As long as you have an MRI that shows there's not anything urgent that has to be done to fix your shoulder, then you can use any alternative treatments that you desire. Many people try stem cells, many people try PRP injections, many people try acupuncture, physical therapy, all sorts of different alternative treatments, and you can use any of those treatments you want because many times people have really good success with them. You just want to make sure that you have an MRI to make sure you're not treating something conservatively that should be treated less conservatively. We always get questions about second opinions. I think if you're seeing your doctor and you're either not getting enough information about why your shoulder hurts, or you're not getting enough information about what the next step is, we always recommend having a second opinion. Routinely, I see many people for second opinions, and most of the time it's merely a lack of education, that they don't feel the doctor spent enough time with them and hasn't really explained the process well enough for them to understand what's the appropriate next step.